Hello, my name is Debbie Bell, and on behalf of the Franklin County Health Department, I'd like to welcome you to Working on Wellness. We are out in the community once again visiting, and we happen today to be at the Franklin County Public Health Center visiting with some of the staff from the Franklin County Home Health Agency. Some of you may find it interesting to know that Franklin County Home Health has been in business since 1976. These individuals are working extremely hard to keep individuals in their home and receive quality health care in the comforts of their own home. So today, joining me from our Franklin County Home Health staff is Amy Carrico, registered nurse, Crystal Middleton, certified nursing assistant, and T. Hayden, physical therapist assistant. Welcome, you guys.
Thank you.
I'm so glad to have you all joining us today and to shed a little bit of light on exactly what is provided in a client's home as far as home health services are when we talk about that. So I'm just going to toss this question out there, and just whoever wants to contribute can. But the first question I have is, what type of services are provided by Franklin County Home Health?
Our services are, we offer skilled nursing services. We also provide aid services, physical therapy, occupational therapy, and we also provide service for the Medicaid home-based community-based waiver service.
Okay. Now, how would someone go about getting home health services? Do they decide that they are in need of that, or is there a process in place?
We need an order from a physician, and a physician to follow that patient is how you begin hospital services. A lot of time we get those from the hospital that the patient is coming from, or like I said, a physician from a doctor's office will refer a patient for services.
Now, T, I'll toss this one to you. When they decide that a patient is in need of additional services once they leave the hospital, because I know the goal is to get them treated and then get them out as soon as possible back into their activities of daily living and so forth. But when they're making these referrals to home health, do they need to be specific, or does the patient have any type of ability to decide which home health agency they use?
Yeah, we all as patients and we all have a right to decide which home health agency we use. So there are several agencies in the county. So when you are in the hospital, or if you go to the physician and they are going to give you physical therapy, you need to be very specific on who you want to provide that care for you. And hopefully you'll say Franklin County Home Health.
Well, definitely there's a good reputation there and the name is well known within the community. So, as we're at that time of year where health insurance is getting ready to, change over, there's a start of a new year. So with home health services, who is paying for that, or who typically covers the bill for these services that are provided in the home?
To pay for home health services, it's Medicare, Medicaid, and any most private insurances. Each payer source has their own requirements, so you'd have to contact your provider to specify what the services they offer with your insurance.
Okay. So as Franklin County Home Health, do we have contracts with specific carriers, or is that's totally up to the patient to, if they know they're going to have a procedure in the hospital, that a surgery that will require home services when they are home, this is something they should do ahead of time, just to go ahead and set that up, have that conversation.
Right. Contact
with their
your
physician.
Insurance to find out if you have any co-pays or what the requirements are. A lot of the requirements for some of your insurance policies are that you be homebound, which means that's due to your recent illness or injury, it's difficult for you to get out, so they require that you be homebound in order to receive those services.
Okay. Now, is there a specified period of time that is required?
If it's Medicare, you have to be considered homebound for the course of your treatment with home health services. If you became where you're not homebound, then we could refer you to, the therapist can refer to outpatient therapy services for that.
Right, but if you have a private insurance, you can do whatever you want, because it is your insurance that's paying for it. So there are several reasons that you could go out. You can go to church, you can get your hair done, you can go to doctor's appointments, things like that. But for the most part, we want you to be home, and that way you stay away from other sick people or anything like that, and it prevents you from getting any other infections.
That makes sense.
Yeah.
It's a good recommendation. Now, I heard you speak on the Medicaid home and community-based waiver program. Can you tell us, Crystal, a little bit more about that program?
The idea is to keep patients at home rather than go to the nursing home. It is a Medicaid-based program for the low-income people.
And that's something that we do honor through our Franklin County
Yes.
Home Health and contract with.
Mhm.
Okay.
We actually, Karen that works with us, she actually does those evaluations where she goes out into the home, does the assessment to see if a patient is eligible for, if you don't have Medicaid now, if you're eligible for the Medicaid waiver service. So we actually do evaluations to see if you're eligible for that program.
Okay. Now, T, going a little bit more specific into exactly what these patients are receiving as far as physical therapy in their home, what do you think would be the greatest benefit or a few benefits to having physical therapy services provided in their home where they live every day?
Right. Well, obviously, the number one reason to have home health is you get to have some of these services provided to you in the comfort of your own home. And studies have shown that people who recover at home, they do that more quickly, and it's more successful when you do the recovery at home. Also, as I mentioned earlier, you stay away from other infections, so you don't catch any other diseases or anything like that. And also, now I'm messing up, and
They just look forward after being in the being in the hospital for a period of time or wherever they're at to get back to their home.
yeah,
You know, and they just enjoy. And of course, us coming in, they love seeing us, and.
And
Yeah.
we also evaluate the home environment for home safety. So when we're in the home, we watch for hazards that the patient might not be aware of.
Right.
Yeah,
Whereas
that's-
when you're an outpatient, you're just working on exercises and things. When you're at home, you're walking through and you're looking for rugs, or you're looking for tripping hazards that you can help prevent, and in that way they don't injure
Yeah.
themselves again.
And
That's
make sure their bathroom is set up, for 'em, after, once we're in there to help them, then after we're out, they can take care of themselves.
Right.
So,
That's wonderful. And, reacclimating them back to, real life every day. There's such benefit in that. And, I think the truth is, too, you just feel better at home.
Oh,
you
yeah.
know?
Yeah.
There's a healing quality, I believe, to that, too.
Mhm.
Yep.
Crystal, can you tell us a little bit about the nursing aid services that are covered under the community-based waiver program?
yes, we go in and do personal care, and we also help with their bath safety. We do housekeeping, we do laundry, and we do respite care, which gives their loved one or their caregiver time to go out and just have some time to themselves. And they get so many units every 6 months, and they get 3 hours to 4 a week, if they don't know.
Meet the criteria.
Yeah, meet their criteria.
You know, this is a really important outreach that we have, especially for our community. So if someone out there is watching and they're interested in, do I qualify? What are is there a deadline for applying for this waiver program? Is there someone that they could call or contact within Franklin County Home Health that could direct them and help with a screening process and so forth?
Yes, they can call Karen Weller or Anita Napier at 564-7383. It's extension 5. And talk to them, and they can lead them in the directions that they need.
Okay. That's terrific. Well, is there anything else that you all feel that our viewing audience could benefit from hearing about the Franklin County Home Health Agency? Do you think of? I know that we've covered a lot of information in a very short period of time. So we may have touched on all of it.
This the program is so needy out there in our community that so many people do not know, because you get that from other people. Will let you know, well, I didn't know that was out there, but it is a really good program. Home health is a needy,
Sure. Well, I'm really looking
Okay.
forward to seeing some of the hands-on services provided with some of our other Franklin County Home Health staff. But I want to thank you all for being with us today and for sharing the information about the Franklin County Home Health Services and, how someone would go about, acquiring services from you. And again, if you could share that phone number with our audience.
502-564-7383, extension 5.
Okay, very good. Well,
Thank you.
thank you all so much.
Thank you.
Here we are at the home of Mr. Donald Williams, and we are joining in on a Franklin County Home Health home visit. So thank you guys so very much for allowing us to come in and participate in your visit today.
You're quite welcome.
Kathy, can you tell us a little bit about the home health services that are provided here for Mr. Williams?
The services that I provide for Mr. Williams for nursing, I change his catheter once a month, and I see him every 2 weeks. I supervise the home health aides for the personal care that they provide, helping him with his shower so that it makes him more safe in the home. And then I also do medication pre-fills. Mr. Williams, with the amount of medications that he's on, gets confused with his medications, so I come in, pre-fill all of his medications so he knows what he's supposed to take and when he's supposed to take it, and it keeps him a lot more compliant. And then I just assess his vital signs and so forth during the home visits.
Okay. Now, we're going to get a blood pressure, I think, on screen today. So
Yes.
really excited about that. And while Kathy's getting ready here, Mr. Williams, can you maybe tell us a little bit about the benefits that you receive from Franklin County Home Health? Why is it important to you?
I can't keep on any schedules. I get very confused, like on the medications, and it's hard to get into the showers to take your baths and stuff of this nature without follow. I fell a couple of times in the shower, so it saves that. And also, Kathy changes my catheter, and that saves me a trip to the doctor's office. And I'm all for home health. I tell you, to me, it saves our insurance companies and Medicare and all the involved. It's so much cheaper and so much easier for them to come to your home and to take care. And I'd rather be here than to be in a doctor's office or a hospital for them to do the services that they provide. But without them, I wouldn't be where I'm at today. That's for sure. That's for sure. I've got the motivation to lose weight and cut my medications back, and I don't know what I'd do without them.
Now, I understand you've had some success with a little bit with some weight loss and some of the
Yeah.
physical activity you're doing. You want to share that with us?
Yeah, the physical therapist come over here. Kathy set that up for him to come over, and D was his name, I think, wasn't it?
T.
T came over and got me started on it. And ever since then, on my exercise program, I've lost about 62 pounds.
That's wonderful.
And when they tell you that that's the only answer is do that or die, well, you get motivated to do something.
That's a good motivating factor.
Yes, indeed.
Yes, sir.
Yes, it is.
Well, Kathy, did he get a good report on that blood
He
pressure?
did. He
Yeah.
did. He's been doing well with his blood pressures lately, so
Yeah.
That's wonderful.
compliance with medications.
Eating right and exercising.
Yes.
That's key.
That's the key to it.
It is.
That's
It is. Well, do either of you have anything else that you'd like to share with our viewing audience as far as home health is concerned?
Well, like I say, I don't know where I would be without them. And honestly, they take care of all my basic needs to survive, really. I say that very easily because it's true. Everything that they do is I don't know if I could keep records on it or keep it on an active basis. But I don't know what to do without them.
Well, that's a huge compliment.
Mhm.
So I thank you so much for inviting us into your home today and for
Yeah.
speaking to our viewing audience.
You're quite welcome. Anything I can do for the home health agency, I'm here for it.
Thank you. We are now joining our second home health visit, and we are pleased to be in the home of Joanne Reynolds. And our physical therapist joining us today is Josephine Lenora. Ladies, thank you so much for being with me today. Miss Reynolds, thanks so much for welcoming us into your home.
Well, I was glad to do it. When Josephine asked me if I could be part of this, they were so good to me when I got home. I wanted to return the favor.
Well, we certainly appreciate it. Josephine, can you tell us just a little bit about some of the home health services that were provided to Miss Reynolds here in her home?
Miss Reynolds, she received physical therapy, and she also received occupational therapy, which helped her with her bathing and upper extremities exercises, and physical therapy for her walking and her strength for her legs, so she'll be able to walk again.
And Miss Reynolds, can you tell us a little bit about what initiated your call for home health services?
Well, what happened was I tripped in my house and broke my leg. And I was in the hospital 4 days, and they were talking about putting me at Cardinal Hills for therapy. And I asked about home health, and they checked into it and said yes, that would be provided. And that was the day before we were having Thanksgiving at my house, so I was able to be home for the holidays.
That is wonderful. That's wonderful. And can you tell us a little bit about what it has meant, or what are some of the benefits to receiving that therapy in the home versus being in another facility for that
Well,
rehabilitation?
Never being in another one, I can't really say if it would be better or worse. In my opinion, it's so nice to be home and be able to have family come in and have family even help with anything I needed instead of being with strangers.
That's a great point. And Josephine, is there anything else that you'd like to share with our viewing audience in regards to the PT services that can be received through Franklin County Home Health?
Just want to let them know that Franklin County Home Health services includes like physical therapy, occupational therapy, and we have nursing, 2 skilled nursing and home health aid that could help the patient stay in their house instead of going somewhere else. And if you have any need of therapy services, please join us at Franklin County Home Health.
Wonderful. And Ms. Reynolds, is there anything else that you can think our audience needs to know about home health?
Well, home health has always been there for my family. In fact, I'm 3rd generation. My grandmother had Alzheimer's, And for 6 years, she was able to stay home and peacefully pass on. After that, my aunt became an Alzheimer's victim, and she also was taken care of by home health. So I have my grandmother, my aunt, and myself. So we're third generation I don't know if you want to say victims or customers.
Sure. Well, that does speak well to Franklin County Home Health that you would call on us again.
They were wonderful, that's all I can say. And it was good to have somebody popping in they'd visit a little bit and talk and see what was going on to find out how I really felt. So.
That's wonderful. Well, ladies, thank you so much for your time today. Ms. Reynolds, it's been a joy to come into your home. Thank you. And I'd like to thank everyone out there that has joined us today. If there's a topic that you'd like to see us embrace and discuss on working on wellness, please feel free to visit our website at www.fchd.org, or you can call us at 564-5559. Thanks, and we look forward to seeing you next time.